So, my name is Mark Debus. I'm the manager of behavioral health services at Sedgwick. I lead a team of licensed mental health clinicians in our managed care department. I'm also a licensed clinical social worker, and I've been with Sedgwick for 15 years. I wanted to welcome you to our discussion today about mental health matters, and I'm joined today with Rebecca Sherman.
Hi, thank you for having us. Like Mark said, my name's Rebecca Sherman. I am a licensed master's social worker. I've been with Sedgwick for about the same amount of time, about 15 years, working in this current role that I'm in under the work comp umbrella in managed care for about 2.5 years. And I look forward to our discussion today. Thank you for having us.
I just want to check in with folks. There is a chat feature. I believe it's on the right-hand side of your screen. You can enter some of your questions. After our discussion, we'll have time to address your questions, probably toward the 35-minute mark. So I want to start off with some basic statistics. Great. Thanks, Joe. So today we're talking about mental health matters, and I really just want to start off with a disclaimer. If you're looking for a PowerPoint-heavy presentation, this is not it. This is more of a discussion with two professionals in this environment, and then some discussion later with everyone. But I did want to include just a real simple slide on some basic stats to kind of guide us and keep in mind why we are talking about this topic, because mental health does matter. It matters from our societal standpoint, American society, but also in the work comp realm as well. So I've included some basic stats. These are taken from SAMHSA, Center for Behavioral Health Statistics and Quality, the National Survey on Drug Use and Health from 2019 and the first and fourth quarters of 2020. We selected these statistics because they actually took place most recently during the COVID pandemic, and the ones that I'm including today are ones from 2020. So overall, 21% of all Americans, adults 18 and over, have struggled with a mental illness in the last year. That's 21%, that's 1 out of 5. 8.4% of all American adults experienced a major depressive episode over the last year. And it's even higher for younger age groups. So those 18 to 25 younger, so Gen Z mainly, 17% of them had a major depressive episode in the last year. And then when you look at comorbid conditions with mental illness and substance use disorder, 6.7% of American adults experienced that in the last year. And that's just in the last year. And those were people that answered positively on a survey. I'm not sure. I imagine the numbers are a little bit higher than that across all Americans, but those are ones that are participating in the survey that actually answered honestly about that. There's also a statistic I want to bring out that 54% of full-time employees and 52.3% of part-time employees did not receive adequate mental health treatment for their mental health conditions last year. So these are the ones that expressed that they had a mental health episode, depressive episode, substance abuse disorder episode, and did not receive proper treatment in the last year. So over half did not. There's all sorts of possible reasons. The first we would think of it because of COVID and the restrictions with COVID, but that really wasn't the case. Only 2.4% of those cited COVID-19 as a barrier to adequate treatment. So why is this important? We'll talk about a little bit about that in just a moment, but I want to talk a little bit about sort of our background in social work and why we are even in this space. Rebecca?
Yeah. You're probably wondering why you've got two social workers kind of coming in talking to you about mental health. And, there's a lot of different mental health professionals out there, and social work has quite a unique perspective. And it's something that we want to share with you because it's kind of the background and our basis for working with injured workers, and also for kind of how we approach mental health as a whole. And basically the idea behind clinically where social work starts is we look at people as a whole. So we're looking at them in their entirety. We're not looking at just a mental health condition, we're not just looking at just an injury that occurred. We're looking them from an entire perspective. So we look at them in relationship to their environments. So if you can imagine, the environments that you find yourself in every day, that would be work, that would be home, that would be your social environments. And then we also look at that individual in relationship to how they're interacting with others. So, what are their interpersonal relationships and how might that be affecting them? So, those again could be relationships with their team lead, with their supervisor or manager, with coworkers, with their spouse. And, we find that these environmental factors and these relational factors come together and really do impact kind of everything that a person is dealing with on the whole. And we start from a strength perspective. So we're looking at we all have things that we're good at. We're looking from a perspective of this is something that they're really good at. Let's build off of here. And social work is about supporting somebody to make decisions that are in line with their moral beliefs, with their that are congruent with where they want to head, that are consistent with their values. And social work is about supporting that. And it's a really kind of a broader picture of it's not an illness model. It's not here's just a one facet model. We're looking at that person as a whole and starting where they're at. And it's a really good approach. We found we've had there's a lot of receptiveness when we're talking to injured workers, specifically in work comp, about that, but just talking to regular human beings too. We don't want to be seen in a vacuum, just defined by one thing. So that's kind of the background of where social work comes from with mental health.
And so before we go any further, we mentioned COVID a little bit ago, and I just want to acknowledge the elephant in the room. And Rebecca and I have been talking about this a lot lately,
Yeah.
but just the impact of COVID and how it has sort of changed everything. And also changed nothing at the same time. Mental health issues have always been there. We have a question here. Someone was asking about our mental health issues based on origins from adverse childhood experiences. The survey didn't really address those origins so much, but people come with their own baggage and they come with their own past traumas and their own history of struggling. The verdict is still out a little bit about how much mental illness is related to organic causes versus childhood traumas. It depends on the illness actually, and what prevalence will be there. But one thing that we do need to acknowledge is that all of us, regardless of our history and our pre-existing conditions, all of us have been impacted by COVID-19 in the last 18 months. We're close to almost 2 years now, and it's impacted us in a lot of different ways. Um, you know, Directly with those who've actually been diagnosed with COVID-19, the symptoms, the loss of breath, loss of functioning, hospitalizations, ventilation, all of those things that the treatment modalities have certainly taken an impact on people. But the disease itself has actually impacted people in not just physical ways, but also cognitive functioning ways as well. And we're still seeing some evidence of long haul symptoms that could be very troublesome in possibly the years to come. And that's just the disease itself. But, also just societally, we've really been impacted by this, depending on where you live. Rebecca and I have talked about this before. We both live in different parts of the country. I live in an urban area, Chicago, like in a very densely populated area. And I was just kind of casually mentioning, like, I bet a lot of people have been impacted by this. And just within the geographic area that I used to walk my dog, over, I think it was 500 to 800 people have died in just a very small circumference from where I live, or small distance from where I live. I know, Rebecca, you live in a suburb of Detroit, and
Yep.
your neighborhood's a little different than mine. My boss's neighborhood, she lives in kind of a rural part of a southern community, and so she hasn't seen as much face to face as I have, or Rebecca has, but it's certainly impacted us. And then, collectively, we've been dealing with the trauma of most of us have known somebody who's experienced it. Many of us, I think the numbers came out yesterday, was 750,000 Americans have already died from COVID since the pandemic began. It's a pretty high number. It's an extremely high number. 750,000 people have died already. Many of us know someone we've lost. Some of us have had multiple losses. So, collectively, a lot of us are grieving the loss of loved ones, coworkers. We've lost coworkers even at Sedgwick from this disease. Other people in the field we've dealt with. We've tried to refer to some providers who've died since the pandemic started. It's really impacted all of us in some ways. And then it also impacts the worker. In the work comp realm, even if they are not filing a claim for COVID, and we certainly did see it, obviously, many COVID cases come through with workers' comp claims, but even people that work in environments where there are high COVID rates, like healthcare, like retail, hospitality, the travel industry. A lot of flight attendants are dealing with this right now with unruly passengers related to mask mandates. There's a lot of things that are impacting people's motivation and readiness to go back to work. Or maybe they have fear or anxiety about returning to work because of COVID exposure, or dealing with the public. That's been very politicized over the last couple of years. That makes it very challenging and stressful to return to work for reasons that have nothing to do with their workers' comp injury or their recovery. So we're dealing with a lot of that as well. But I thought, interestingly, there are some, I don't know if I want to call them positive sides, but Rebecca, you were kind of mentioning to me the other day about some of that.
Yeah, Mark and I have talked about this quite a bit, and there's always the yin and the yang, and the good and the bad. And as a social worker, I'm always kind of trying to find, okay, what's the thing that we're taking away from this? And I do think we'd be remiss if we didn't recognize that there have been some good things that have come as a result of the pandemic. Obviously, not taking away all that Mark just talked about and grief and loss, but there are some things that have come to the forefront as a result of the pandemic. And, some of the things that come to mind that we've talked about is telemedicine. That used to be something that was not available to everyone. That was not something that was a gold standard for care, that was not something that was a go-to for care. And now pretty much it's for mental health and for physical health appointments. Telehealth is an option. It's become functional. It's become necessary. And we've kind of worked around some of the barriers and some of the constraints that COVID has placed on us so that we can still function. So I think that access to healthcare is still something that, we're getting creative with it. We have different options now. I also think that, one of the most exciting things for me, and I do say exciting because it really is the stigma related to mental health issues is really, we're really changing the conversation. And I believe it's largely due to COVID that we are having different conversations about what mental health looks like. And, just having it be part of the mainstream conversation. There's not the stigma associated with, number one, not only talking about having maybe a panic disorder or having anxiety, but then also in treating that and going for help. And I think that it's the example that I think of most highly was Simone Biles in the Olympics. And obviously, if anyone was watching that story, and most people were, she really was able to stand up for herself and to recognize her need to take care of her mental well-being, despite other things, despite other commitments. And it started a conversation. It started a conversation with that community, and it started a conversation with lay people too, because, like Mark said, 1 in 5. So that's a pretty high number of adults who have had some kind of mental health illness. And, I've been in the field since the 80s when there were state hospitals, and, we put people in the hospitals, and we didn't want to deal with that. And then, the whole progression of, we don't talk about mental health, just even how it's been discussed in my family growing up, from how I talk to my kids about mental health to how it was talked to me, from my parents. And so I think now the discussion is very obvious and very out there. And because of that, we have so many more resources, because it's at the forefront. People are paying attention. People want to recognize that this is not something that we can just let go. It's as important as our physical health. So that is very exciting to me. And, I always, and Mark, you kind of alluded to this, but we've had this shared experience through COVID. And I feel like, I view mental health on a continuum, and we're all on that continuum. And, some of us are healthier than others on any given day or at any given point in time. But when the pandemic hit, that dial got turned up for all of us. We all experienced an increase in,
Mhm.
mental health issues. And that really resonates with me. And I think that that sense of collective experience has brought us together with at least the ability to have these conversations a little bit more.
Yeah, I agree with you. It's a collective trauma. I mean, that's really what
Yes.
it is. And there's very few examples recently. I mean, there actually are a few examples, but there's not a whole lot that has really brought people together like COVID-19. I mean, COVID-19, how many conversations did we have during the lockdowns and the pandemics? Like, oh, what are you doing today? And oh, or another Zoom call, and just kind of gallows humor about it, but that we're all sort of in this together in a lot of ways. It actually reminds me a lot of what we all experienced after 9/11.
Yes.
I know it's become a little cliche lately. I'd almost harken back to early days of the AIDS crisis back in the 80s with the LGBTQ community. Although AIDS didn't impact all communities equally, obviously, it really did galvanize a movement in the LGBTQ community to band together and seek out some treatments and advocate for themselves in a way while they were also processing collective grief and loss and trauma. A lot of similar parallels to what we're going through now. Um, Again, with the way the United States is and the way certain populations are spread out, and urban centers versus rural and suburban and exurban, all that. COVID has impacted different communities differently at different points during the pandemic. I think it's actually touched everybody now in different ways, but also in similar ways. And it's something that we all share in some conversation about, whether those among us, and hopefully not so many in the audience, think it's a hoax. We certainly approach it from a very a reality-based and sort of experiential based. We know that our injured workers that we're working with have direct experience with this, so we
Absolutely.
we we don't tiptoe around it. We talk directly about it, and it is something that has allowed us to um, identify with them. And I think also just you know we're talking about shared trauma. I mean, how much time do we have? Unfortunately, we're still in this. So shared trauma is actually going to impact people's mental health. And so, why is this relevant? I mean, underlying mental health conditions can get triggered during trauma episodes. So, we're seeing some of that. But also, just in general, one thing that we're kind of switch gears a little bit away from COVID, but one thing that we're looking at just with mental health interventions anyway is what does that look like and how does that impact people? I mean, real world example in the work comp realm that we see a direct impact of underlying psychological conditions is in the area of pain management.
Mhm.
One thing we see a lot of is if someone has an underlying anxiety disorder or a PTSD, or in this case, COVID stress, which is, again, something a lot more people are dealing with. Um, that's going to change their experience a pain. The research supports that if there's an underlying anxiety disorder, that someone's experience of pain is going to be catastrophized because there's a symptom of anxiety disorder that's called catastrophic thinking, and it's where people kind of jump to conclusions or jump to the worst case scenario, if you want to put it in lay terms, and their thought process is altered because of their anxiety disorder. And not everyone has an anxiety disorder because of COVID stress, but it does lead people to be more anxious in general. So you're going to see some of these symptoms come up more frequently. We see it in the area of pain management, where people are elevating or expressing elevations of their pain levels. You'll hear this a lot with injured workers describing their pain as 11 out of 10 or 20 out of 10, or every single day is 9 out of 10 every single day.
Yeah.
We also, we know that like that's not physically possible to live in a 10 out of 10 pain level, because how do you function? You can't function with that. And yet maybe they're still driving to appointments and walking and getting out of bed and those types of things, where normally a 10 out of 10 would be something so excruciating that you'd be bedridden. But that's people's experience of pain, and if they have an anxiety disorder or feeling anxious because of environmental factors, that's going to change their experience of pain. So it really alters how we approach pain and pain management. And doctors need to be aware of that there might be some elevations or exaggerations of pain experiences. So one thing that we always encourage our examiners and just among ourselves when we're working with people with work comp injuries is, we really need to act with empathy, compassion, and sensitivity.
Yeah, I completely agree with that, Mark. And we're talking about this in this work comp forum, but I also feel like we can apply this to our interpersonal relationships as well. Sensitivity and compassion are two things that I lead with every time that I am speaking with someone, whether that be an injured worker, whether that be someone in my personal life. At least that's what I strive to do, right? Because I'm not a perfect person. I'm human first, right? But
You're pretty close. You're pretty close.
Oh, but we're talking about identifying with somebody and building rapport with somebody and letting somebody know that we really care about what's going on with them, that we want to understand where they're coming from. In the work comp realm, this helps people feel comfortable talking about things that maybe have nothing to do with their work comp claim. Maybe they're having marital issues. Maybe they're having some other things going on in their life. And these are really impactful in people not going back to work, in people's motivations and people's compliance with treatment. And I've found that it's really very basic. People just want to be heard, and people want to be validated.
Absolutely. I was on mute there for a second, but yes, I agree with you completely. And you've just defined empathy. I mean,
Yeah.
that's really what it is. The goal of empathy is connection and understanding, and that's what we need to do. I did want to. Someone had commented pondering how mental health concerns are due to social media overload and the perceived outline that everyone else is perfect and we know that we aren't. That's a really good observation, Rosemary. Thanks for sharing that. And that's exactly right. That's sort of the opposite side of empathy, is sort of comparing yourself to other people, and that can be it can have the opposite effect. It builds disconnect among others, and that's the last thing we want to do, especially when we're relating to folks that are injured and trying to recover. Um, One thing I want to make sure we have some time for, and I know this is an area that Rebecca is an expert in. I want to talk a little bit about, and we've got just a little bit of time to cover some of this, is how do we build resilience among our injured workers, but also among our coworkers and our families, for ourselves. There's a lot of self-care that needs to happen in order to manage stress, whatever the source of stress may be. There are things that are within our control that we can do to address that and hopefully manage it a little bit better. So I wanted to have Rebecca, if you wouldn't mind talking a little bit about some of those self-care strategies, that'd be
Yeah,
great.
absolutely. I could talk about self-care all day. I don't know that I'm an expert, but it is one of my passions. And I just want to go back to Rosemary's comment about how social media impacts our mental health. It really does. And there's a lot of studies, and obviously there's been the Facebook blow up, and there's been some things on TikTok that I just recently read that there's people that are developing tics, young girls that are developing tics by watching people who have tics on TikTok. I mean, we've come into this kind of voyeuristic ability to see everything. And I would say this is one, put it on my healthcare tips. Comparing yourself to someone else is not where you need to be. You want to be the best version of you, because you can get too overwhelmed with social media. Additionally, you can get too overwhelmed with news and trying to figure out what news is accurate. And that was one of the tips during the pandemic. Find a reliable news source and make sure that you're following that. So let's talk a little bit about self-care. I mean, there's a lot of things that I could talk about, and I know our time is limited. So maybe next year you'll invite us back and we'll just talk about self-care all day long. Um, but here's the thing. Why is it important? So again, we talked about that mental health continuum, and there are stressors in our lives that cause us to not be able to react how we should, right? And so if we can reduce our stress and kind of keep ourselves more equilibrium, then when we have things that are outside of our control, which, let's face it, most of the things in our lives are, those aren't the things we're focusing on. We're going to focus on the things that we can impact, the things that we can control. And if we're taking care of ourselves on a daily basis with our mental health respect, we can deal with those unexpected things a lot better. So again, I want to stress that mental health care is a daily practice. It is not, if you see a therapist, it's not, oh, I do the homework my therapist assigned to me. It's 5 minutes before my appointment. I need to go in and think about that. It is a daily practice. We brush our teeth every day, hopefully, 2 or 3 times a day, maybe. We floss. We also go to the dentist. We go to the orthodontist. We do other things. Mental health is very similar to that. I would suggest to you that if you're not in some kind of awareness about your own mental well-being, then now's a really good time to start. It's something that we need to approach every day. From a clinical perspective, when I am looking at people and discussing mental health issues, the first thing that I think about is sleep. And this is so crucial because we need time to restore, right? We need time for our bodies to shut down and get rest when we're not feeling well. We need time for our mind to shut down so that we're not always going, and we're not always thinking. The what I've the research shows, and this was just recently on Good Morning America as well, 7 to 9 hours is that sweet spot of that adults need to get adequate sleep. So too little is not so good, and even too much sleep is shown to be not so good. So really, that 7 to 9 hours. If you're not getting that 7 to 9 hours, why? This is something that you need to be looking at, and I would suggest this is where you start with your self-care practice. And there's a lot of information out there about sleep hygiene. I can just throw a few things out at you right now. One, you want to make sure that you are getting into a routine. You're trying to go to bed at night at the same time, that you're getting up in the morning at the same time, that you're not taking naps during the day. I would suggest that you're not getting too excitable before bed, meaning you're not drinking caffeine or alcohol, meaning you're not on your screens, meaning you're not watching scary movies or, having deep discussions that are going to cause you distress. So there should be some kind of wind down time for you before you go to bed. A lot of people need very specific things to sleep. So get a good mattress, get a good pillow, get comfy blankets, get luxurious pajamas, optimize the room, optimize your environment so you can get good sleep, get dark blinds. If you need to get a noise machine, some people like it super quiet, some people like it super cold. So just be aware of what your needs are to optimize your sleep habits. And there's a lot of information out there on sleep hygiene, but those are just some basic suggestions. Um, I think sleep is super important. Another thing that I talk to people a lot about is movement. And I find this one has been challenging for me since I've been working from home, because when I was in the office, I would get up, I would, walk around downstairs. I would, on the hour, I might, anytime I would go to the bathroom, I would go downstairs and do a lap. And now I can sit in my office here at home for 3 hours and not move, and wonder why I'm feeling so, out of it. Movement is really important. And that can look like a lot of different things. It can look like just getting up out of your chair. We've all probably heard the saying that sitting is the new smoking. So, we really want to move. This is good for your physical health. It's also good for your mental health. That movement, the endorphins, the ability to connect with your body. This is all stuff that we want to have happen. And there's a lot of research related to decrease in symptoms of mental health disorders, specifically anxiety and depression, related to an increase in movement. And so that could look like, again, a lot of different things: yoga, Tai Chi. It could be simple stretching. It could be walking. And again, when we talk about this in the work comp realm and we're dealing with injured workers, we look at like a chronic pain patient, or we look at someone who has limited mobility. But there's always an opportunity to move in some kind of way. So movement would be my second thing. And my third big ticket item to take away would be breathing. And I know it sounds kind of silly because we all breathe, right? And we do that. That's an autonomic nervous system. That's not something that we're thinking about, but I would suggest that we do think about it. I think it's really important to connect to your breath. And there's a lot of different reasons. There's a lot of mindfulness that goes along with your breathing and being in the moment. And this is something that we deal with when we are overwhelmed. How do I get back to feeling grounded? How do I get back to being in the moment? How do I just take a beat with whatever I'm dealing with during the day? There are so many different breathing exercises, and I won't go through all of them, but you can Google them, and they're out there. There's 4-7-8 breathing that was developed by the Navy SEALs, actually, for divers who were dealing with panic and anxiety. There's box breathing, there's diaphragmatic breathing. There's a lot of different things that you can do to connect to your breath. And along with that could be a grounding exercise, a meditative exercise. And it's really important to kind of have that self-awareness. And that would be what I would leave you with too. And Mark and I talk about this all the time, but we are always, obviously we're in the field, we're social workers. We talk about empathy and connectedness, and, we talk about this stuff. This is our just daily conversation, but we do a regular check-in with each other. And before I can tell Mark, how I'm doing, because he always asks, God bless him, I have to know how I'm doing. How am I doing today? So I would suggest to you that do a check-in with yourself. Figure out where you're at emotionally. If this is new work for you, that's okay. It's going to take a minute. It's going to take some practice, but knowing where you're at on any given day, like, wow, I'm having a rough day today, or I don't feel well today, or I'm stressed. It helps you kind of identify where your limits are for the day. And it also, if you can express that to someone else, I would suggest for leadership, that's a really good place to start with your employees. How you doing today? Where you're at? It kind of gives permission to have a discussion about expectations for that day, and also to give some grace to each other.
Mm-hmm. Absolutely. Yeah, and I do that as a manager.
Yes. Yeah.
I mean, I check in with my team, but I mean, I certainly I care about them, but I also want to know, like, how am I going to manage them that day? And
Yeah.
it provides me with some information. Um, and I'll just tell you, I mean, one thing in my background before coming to Cedric was working in employee assistance programs for part of it. And I know you have some experience too, Rebecca, in
Yeah.
EAP. Um, so we've worked with a lot of management groups on these very issues. And one question that comes up and comes up now with our current role is, but I don't want to be their therapist, And so a lot of managers are really concerned, like, if I talk about emotions, am I going to be the therapist? Are they going to come to me with all their problems? And my answer is no. I mean, but they will see you as a kind person, and they'll see you as someone who provides an open space for them to come to you if there's an issue. So I see that we've got about 10 minutes left, so I wanted to make sure we had some time for some questions from the viewers, our participants. So, Rosemary, thank you so much for sharing some of your ideas about the IME. I appreciate that. I think everyone can see that, but if not, I will go ahead and. Um, so, Rosemary, you're an advocate for injured worker community, and it's your experience that injured workers answer the questions they're asked in line with the person asking the questions. If they're told in IME that they were managing their pain, the IME report would indicate that they are malingering rather than the truth that the injured worker was having a good day. Yeah, there's definitely some truth to that. We have to be really careful about. Um, eh, I'll just be honest with you. When I work with injured workers, I approach everyone as if they have only good intentions until proven otherwise. That's just gets me through. Plus, it also allows me and opens me up to seeing a bigger picture of what's going on for them, and also become more attuned to other things that might be impacting them. Again, we talked about motivation. Before. But really, I'm really focusing on what are the barriers to motivation, and what is that person's experience like as an injured worker, but also as a person struggling with whatever personal issues they may be having. Our role is a little different than examiners and other risk managers, but it doesn't hurt to see the person as a whole person, kind of in a setting that is sort of interconnected. And there may be a lot of other stressors that are going on with them, or maybe they're having a good day, and that's why they don't seem as much in distress today. So it's just it's important to remain open to any of those possibilities. I want to see, does anyone else have any questions? Feel free to enter a comment in the chat. And if not, that's okay too. I want to kind of circle back to what we were talking about, the social media. I know, Rebecca, you talked about sleep hygiene. One of the tips I always give is do a media blackout 2 hours before bedtime.
Yeah.
And I tell everybody this, like, if you want to get good sleep, do not look at a screen, don't look at your TV, don't look at your laptop, don't look at your smartphone at all for 2 hours before bedtime. Read a
Yeah.
book, listen to music,
Yeah.
have small talk with your loved ones, maybe talk with a friend, but try to have some. For me, when my dog was still alive, we would go for a walk at night before bedtime, and that actually helped with kind of shutting my mind down a little bit. It was that routine. We both enjoyed it. He got his little sniff walk in, and I got to kind of relax into it a little bit. Um, and that became like a part of a routine. And then we had some other parts of the routine. There was a treat involved, and gosh, I really need to get another dog, but that type of thing. But I always made sure, and I tell everyone this: do a media blackout 2 hours before bedtime, because I will tell you, the way the media is um, designed now is to elicit an emotional response from you in order to engage you and, in their eyes, addict you to the media. And whether that's on TV, whether that's social media, Facebook, whatever, even LinkedIn is kind of designed a little bit to foster engagement. That's the last thing you need to be, is you're trying to quiet your mind before bedtime. So I always add, like, make sure you do a media blackout 2 hours before bedtime. And then, we talked about technology a little bit. There's also a lot of apps now that,
Yeah. I was thinking about that.
yeah. So there's a lot of free content out there. If you have a smartphone, a little contradictory to suggest looking at your smartphone, but don't do it right before bed. But there's a lot of apps out there that you can download or access relaxation podcasts that are free of charge. There's some that are just designed for meditation. There's some with a timer on it. I'm not going to endorse any right now on this talk, but there's quite a few out there that are absolutely free, that are very user friendly and can be really relaxing for people to engage with. And we give out some suggestions when we talk to people all the time. And I know, Rebecca, I've taken a lot of suggestions from you on some of those. Hopefully you've picked up on some of the ones I've suggested
I
too.
absolutely have.
But
Absolutely.
that's another use of technology that can be really valuable when trying to unwind after a crazy day.
Yeah, and a lot of those apps too have some minor psychoeducation kind of things too that
Mhm.
are beneficial.
Yeah, yeah. You don't need to be an expert in any of this.
Right.
Rosemary, you've developed a series of documents for members of the community. Um, that's great. You sound like a wonderful advocate, Rosemary. Thank you for sharing that. Um, yeah, that type of education is important. But again, I think the key is that you're really seeing somebody who is struggling with not only their injury and their recovery, but also sometimes a system that is cold to their needs. And
Yeah.
as an advocate, you understand the value of that engagement with them and seeing them as a person who's struggling. So that's a good reminder. Thanks for sharing that. So I want to thank everybody for joining us today. We've got a couple minutes left, but I think I don't see a lot of other questions in there. So I want to thank everybody, and our contact information is on the slide here. If you had any questions for us, those are our email addresses on there. Feel free to reach out. Be happy to answer questions you might have, or if you have some more questions about our services at Sedgwick, let us know. But again, I thank you for your time today, and on behalf of both of us, enjoy the rest of your day and the rest of this conference.